Okay, so I told you yesterday, those of you who were here, and I said in my email that I am taking full responsibility for the lack of, I just have not invited great participation in this series. And so I am uh, trying to change that. So today is going to be a very um, participative session, hopefully. Um, so I have some questions that I'd like to ask throughout the call, and then I um, we'll also have some statistics, some research that's been done. Um, if you're not in a place where you can unmute and talk, feel free to use the chat. If you have questions or comments that come up through the Zoom, um, feel free to bring them up. This is going to be one of those that hopefully we'll be able to have good discussion and talk a little bit about how stigma and stigma reduction directly affects each of us in our own communities and within our own cultures. So this is one that hopefully will be a little bit more relatable to your specific situations. So the very first question, and it'll kind of spoil what we're going to talk about today. But what are some of the elements that define culture? And I know there are so many that we're not going to be able to cover everything, but what are some of those?
Religion.
Religion's a big one, especially, we're in a very religious state here in Utah. So that's a
Mhm.
huge one. Backgrounds, yeah, our um, who our parents are or our caretakers. That defines culture from the very beginning of life, really all the way through ancestors. Um, yeah, especially traditions that are passed down from ancestors and different. Um, I mean, culture is fed from many different cultures and the meeting of cultures. Immigration status, country of origin. Yeah, that's a big one too, and um, a big one in the evolution of culture. How parts of different cultures come together.
I even think just like your general location of where you live in the state has a lot to do with it.
For sure. For sure. Life in Price looks a lot different
Mhm.
than life in um, downtown Salt Lake. Um,
Correct.
yeah. Or even, life in Price looks a lot different than it looks in um, Tickaboo, you know? So
Exactly.
for sure, that's a huge part of it.
I think you have to recognize in Utah as well the uniqueness of these communities that with the closeness to so many national parks that in this when you look at rural Utah versus the rest of the United States, I think folks in rural Utah get exposure to more types of people from more places, especially if they work in the tourist industry because of the national parks, which creates a weird dynamic.
Yeah. Oh, for sure. For sure. That's a huge one. People come from all over the world to visit Utah to go to the national parks, and so that's a huge one. Uh, Lauren in the chat, access to different things like healthcare and education. That's a big one. Um, whether you can access that by walking down the street or if you need to go travel or if you need to have telehealth or if you have doctors come visit you, healthcare providers, that's huge. Yeah, that's a great start on culture, and and we'll talk about a lot of these things as we go through because the next thing I wanted to ask, and we're sort of spread out across the state. I know we've got people in Price, people in Emery County. Um, I'm in Cedar City. We've got people from St. George, so we're kind of spread out. So let's chat a little bit about how elements of culture show up in your communities? What are the things that stand out about the culture of where you live?
In Price, I would say kind of diversity.
Hmm.
There is a very diverse population when it comes to different religions. Greek is a big one down here. And we have a big LDS population, but we also have a rather large Catholic and then also other non-denominations. But I kind of feel like we're pretty, I don't know how to quite say it, but we have kind of just like accumulation of many different religions there.
For sure. Yeah, Price um, is different than a lot of the state in that regard.
Mhm.
And especially some of these industrial or mining towns, you see that again. Caitlin, I saw your question in the chat. The question is just how the elements of culture, or I guess a better way to phrase it is what is the culture of the community where you live or where you work? How does culture show up?
I think in St. George, there's this certain culture, like I've noticed from moving from one part of town to an older part of town, like the original people from St. George bring a certain culture. And then all of these new people moving in from out of state into St. George has kind of changed that. And then also with the university growing and bringing in more students, and that's like affected our culture too here in St. George. I've seen like a cultural shift, I feel like, over the past few years where we've grown so much.
For sure. Yeah, it's evolving fast. You got people coming from all over. And St. George is interesting because it's um, climate. We talked a little bit about this in a meeting that I was in earlier today. The climate in St. George is so different than the rest of the state. You've got this little pocket where things are a lot more like, Arizona, um, California, Southern Nevada than the rest of the state of Utah. And so that attracts a different demographic of people. And so that infuses a lot of different culture. Ashley mentioned that rural culture is connected. That's a huge one. In fact, I was listening. Um, my I went home yesterday and um, checked my phone. My friend had sent me a song that he thought I should listen to. Um, and one of the lyrics was "Call your mama, sit and listen to her small town drama." That's what I think of when I think of and there's good and bad about rural culture being connected, right? Um, there is a lot of drama. Everyone's in people's business. Um, I my both my parents grew up in small towns. I grew up in a small town. Um, so there's people that know a lot more about me than maybe I um, would like. But at the same time, in moments of crisis or distress in my life, I knew that my neighbors, my friends would be there and would be there and be able to connect. And so, that's one of those where it's good and it's bad, right? Anything else? Any other elements of culture in your community that stand out?
One thing I feel like here in Price, and Amory probably sees this a lot too, is we get a lot of transient people because they come in for certain jobs, like if the power plant's on an overhaul or things like that. So we'll get a lot of people come in for a couple of months and work, where you can often see our hotels here are filled whenever those times are. But that brings a different level of change to the community as well.
Yeah, for sure. Especially, in healthcare, that does change things. Um, and we're going to talk a little bit about that. Where yeah, you're not seeing the same population of clientele, and maybe you don't have the same recurring people coming in over and over. That changes things for sure. Ashley brings up substance use norms, especially in youth. That's huge. That's a huge one. and one we're going to talk about as well. Not seeing things as dangerous. I know that is a big concern in Carbon and Emery counties and Grand County. And of course, it's a concern everywhere, but I know that's been an area of focus. And that's going to feed into some of our later discussion, but definitely something we see. Caitlin brings up she's in an urban setting right now, and grew up in an urban setting. And she mentions that English is usually not the language spoken at home. And so having services available for people who speak other languages is important. That's a huge one, and definitely something that culturally can be very difficult, is speaking a language where maybe the services aren't available, or harder to find in that way. I'll relate this, and kind of the last few. I served an LDS mission in Nebraska and Iowa, and one of the areas that I served in was heavily immigrant population, one of the most diverse small towns in the country. And of course, being there as a missionary, I maybe wasn't plugged in to all of the challenges that are there, but even just going and meeting people, talking to them about their experiences and learning about their culture and their backgrounds, I could see the difficulty that came from living in a place where your next door neighbor speaks a totally different language than you in the home, and eats totally different food, where your doctor or your lawyer or your religious leader spoke a different language. And we saw it too, of course, because we were, I speak English, and I was assigned to learn Spanish, and so I spoke English and I spoke a little bit of Spanish. But I would knock on people's doors and they would answer, and they'd be from I'm trying to think of all the different places. Cuba, Guatemala, Central America, so I could kind of help with them. But if I knocked on someone's door from the Congo, I could speak my broken English, or my English, and they could speak back to me in varying levels of English. We could sometimes connect on very basic shared qualities of Spanish and French and English, but that made it tough. We would meet people from Southeast Asia, and so that can definitely play a huge role in culture and how it shows up. So this is something, and this is where I'm going to kind of turn it back to you to get some answers, because in a lot of ways I don't know the answer to this. And Ashley brought up substance use norms, and especially in youth, but what attitudes do you see in your communities relating to substance use? What does that look like in your communities? And that can look different in a lot of ways. What are the prevention efforts happening in your communities? What are the attitudes relating to those who are currently using, those who are in recovery or trying to get into recovery? What are the attitudes about relapsing? And what does that look like? Ashley says, so much stigma for adults with substance use disorder. Yeah, and that's statewide, and really just our culture as a country, and it's just sort of where we are in the world. There's a lot of stigma around substance use and stigma towards treatment. And I guess another element of this is, what are the cultural aspects that make it this way? And there are lots, of course, and it may not be something that we're able to pin down, but what are some of the factors that are feeding that? Caitlin brings up, not hearing much about substance use prevention or management, but does hear a lot about suicide prevention. Definite connections there, huge connections there, and a lot of those strategies are similar. So I guess that, yeah, that's definitely lots of connections there.
I think that fear is why we don't hear about things, and there is a stigma because, okay, for instance, I live across the street from a recovery center, and I didn't know it was a recovery center. And when I found out it was a recovery center, like, I'm guilty of saying, oh, do I really want to live across the street from a recovery center? But realistically, I thought about it, like, why would that matter at all, you know? And the neighbors, I guess, when they put the recovery center in, they protested it, and it was like a big deal, but it's a protected class, so it went in anyways. But I thought, this is just a fear-based thing. People just don't know. So there is this huge stigma about adults with substance abuse issues. And it's just like fear and uneducation about the issue.
For sure. For sure. And I don't think that's uncommon. I think that's something that we see, and something that's important to, and we've talked about this throughout the series, to reiterate, is that we've all got biases. They all come from different parts of our upbringing. They all feed into each other. And so that's, I mean, it's normal to have those thoughts. That's what we do with those thoughts that can either reinforce stigma or help us to overcome that stigma and to help our neighbors.
I'd like to also chime in too. I kind of feel like there's a lot of shame based around this. And like, especially, and I'm going to use the LDS religion just because I have a couple clients that are struggling with addiction and within the church, and just the stigma about that and the conflicts with their faith.
For sure. Yeah. Oh, and and I'll disclaim here that I mentioned I served an LDS mission. I'm still an active member. In fact, I serve in an LDS bishopric. So I see this a lot. I see it all the time. And when you are part of a religion that one of the commandments that we're told to live is to not use substances. There is a lot of shame when that comes up. So I see that one all the time, and it's so hard. It's so hard, right? It's on the one hand, of course, we want to hold to what we believe and what we feel like we know, but on the other, we're all human, and we all have things that we're going through, and something that and an example of stigma reduction that I've seen in real life, and that I appreciated, is that in our most recent what we call general conference for the church, the president of the church gave a talk, and he mentioned all sorts of vices that people have, and he didn't just talk about substances or what we learn about in the word of wisdom, which is that commandment that talks about alcohol and substances. He talked about all sorts of things, and things that all of the members of the church are guilty of. Healthy lifestyles. One that stuck with me is having an unhealthy relationship with food, and that's something that I'm working on. And he went through that list, and I just thought, man, how awesome was it that he didn't just sit there and say, those of you who aren't living the word of wisdom, get your life right. It was, no, we all have things that we're working through. We all have those struggles. So that's a huge one that we have to balance. And that's one that in Utah, especially where that population is high, and even where it's not high, it definitely feeds into all aspects of life here. That's one we definitely see.
I feel like that there's a lot of that stigma that prevents people from getting the help that they need.
I completely agree, especially in the rural communities where everybody knows everybody.
Yeah.
Agreed.
Oh, for sure. For sure. That's a big one. In fact, something that was mentioned. So I pulled up a study that was done at Johns Hopkins University in the Bloomberg School of Public Health, and I'm going to cite some of the statistics here. But something that they found in their qualitative study is that people who are dealing with substance use disorder that are religious often feel like their addiction is something that comes from God, that it's a struggle that God has given them that they need to fight. And so that would feed into not wanting to get treatment. You mentioned that, where everyone knows everyone, if they see your car parked at a counselor's office, or they go to work on a Monday and find out that their neighbor has gone into rehab, that right there, that feeds into stigma as well. So for sure, that shame, that stigma, that connectedness, it all sort of feeds each other.
I have a question, just kind of a follow-up question based off of the current discussion. And it's just making me think of like the religious affiliations and different things, right? We are emphasizing the LDS Church because it's so predominant in Utah, but I mean, this idea is across multiple religions, arguably all, maybe. I'm not exactly sure, but I wonder too, and I've heard this from others, the religious affiliation may also play a role in the treatment options that people are even open to, right? So maybe less people would be open to maybe, MAT or MOUD, and maybe would prefer 12-step programs, or maybe that increases the likelihood of 12-step programs being opened in certain areas versus not. I don't know. And I think there's an argument for both programs, right? I don't know if there's necessarily one's better than the other. It's just kind of dependent on the person potentially. But I just was wondering if, people are seeing that who are maybe working more directly in the field or, in rural settings, if others have like opinions on that.
Yeah, absolutely. Have any of you seen that? I don't know the answer to that, but those of you that are working in the field and working in, or maybe directly with clients or patients, is that something that you see, that the religious belief feeds into the sort of treatment options that people are open to?
I'm not sure. This is David. I'm not sure if I understand the question completely, but I know that I'm also in a bishopric, and we've had patients with, or I shouldn't say patients, members of the church that struggled with addiction, and we've actually helped facilitate them getting the help that they need outside of the church, using different resources, counseling, substance addiction resources, many different things. So I think that there's a lot of resources out there, and I agree that there is stigma associated to that. But I wish that wasn't the case, because the church can actually offer quite a bit of help for those members.
Yeah, and willingness to get treatment at all. Ashley mentions that. Yeah, and I liked that you emphasized, we are focusing on the LDS Church, of course, because that is so predominant in our lives in Utah, but it is across religions. But it was something that came to mind when you mentioned that, is that a lot of times you'll see Alcoholics Anonymous or Narcotics Anonymous meetings happening in churches. So that may feed into that. Maybe people would be more willing, if they're affiliated with a church that's having those types of meetings, they may be more willing to that kind of treatment than a different kind of treatment. So that is an interesting question. We may, and Caitlin, I really appreciate that question because it is something that that would be a good follow-up. So I'll see if I can find anything about that. I'll see if I can find some resources, some research about whether that's affecting things. I'm sure it is.
Yeah, that'd be great. And I recently, what makes me think about it, I was on a webinar and it was from, I can't remember the religion, but it was a Christian-based religion, like a church, like a Catholic church maybe that had provided, Alcoholics Anonymous types of a things. But it was for, I think, specifically opioid use disorder. And they were based in a 12-step program, which usually is a program based in like a higher power, right? So there's some kind of higher power and like there's that kind of piece, which for people who are religious or have that affiliation, it's maybe a more comfortable, I don't know, step into getting treatment and getting things sorted out. But they had talked about in their program that we also want to make things accessible for people who are not religious, right? And so sometimes if that's all that you're offering, then you're missing a whole group that potentially is not of a certain faith, but that they always try not to, and I'm forgetting the word now, but kind of bringing them into the faith as well. They're not doing any kind of, like, oh, you should join our church or whatever it is. So that's what makes me think of this is all.
Yeah, no, for sure. And that's yeah, definitely an important aspect of it. Carissa mentions that in working with those struggling with substance use, there's a lot of requests for no religious affiliated services. Ashley brings up USARA, and Jessica and Melissa were on yesterday. We talked about resources specifically and available in communities, and we're gonna chat about that next week. But USARA, who's one of those programs, does a lot of non-denominational programs. So yeah, those are great. Oh yeah.
It's really important that we emphasize that we meet people where they're at, because people's belief systems are central to their health. And so whether that's non-religion or a very strong religion, we have to meet people where they're at to provide the help they need.
For sure. For sure. And that basis, yeah, that can make all the difference. In recovery, having a strong base of something is crucial to recovery, right? That's what, we've got to have a reason. And so whether that's a faith or a family or our own well-being, that central belief and that central reason, that's so important. And so those are sort of I've got a few other questions prepared for maybe later on, but I wanted to bring up this study. Talked a little bit about it a few minutes ago, but again, it's from the Johns Hopkins Bloomberg School of Public Health. And these were some interesting statistics to me in looking at how substance use addiction is viewed directly in relation to mental illness. And those are two things that you will often find, I don't know if grouped together is the right way, but I mentioned earlier that in prevention, which is something I'm pretty heavily involved in my career at this point, whether you're doing suicide prevention or substance use prevention, a lot of the strategies are the same. So there is a relation there. So these statistics I thought were really interesting, really eye-opening. The first one is that 90% of people studied were unwilling to have a person with drug addiction married into their family. And asking the same question about mental illness, it was 60%. So that's a huge one, right? The next one, 62% would work with someone who has a mental illness, Only 22% will work with someone who has a substance addiction. 64% felt that employers should be able to deny employment to people with an addiction, compared to 25% of people with mental illness. 43% were opposed to giving addicts equivalent health insurance benefits to those afforded the public at large, while only 21% are opposed to giving the same benefits to people with mental illness. 54% believe landlords should be allowed to deny housing to a person with an addiction, compared to only 15% for people with mental illness. And 3 in 10 people studied believed that recovery from drug addiction was not possible. So a lot of statistics there about how people view addiction. And of course, within different cultures, those numbers may be higher or maybe lower. But that is just, of course, one study, but it gives a glimpse into how people really view substance use disorder, especially in relation with mental illness. So those were really interesting. And so I wanted to ask, with those statistics in mind and with the questions we've talked about in mind, and I will, I guess, caveat this by saying that every time I have to ask a question like this, I want to end with a question that is a little more inspiring, because this first question is probably going to elicit responses that maybe don't, I mean, they're the truth, they're realistic, but they maybe don't make us feel very good. And I never want to end something like this on a low note. I always want to end on a high note. And so I've got 2 questions, but we'll start with the first one. How does culture, and think about the culture that you're involved with specifically, or I guess how does, but maybe how can is the more realistic. So how can culture reinforce stigma?
I'll try to say something to get the ball rolling, maybe. So just so that I understand, you're saying how does culture lead to stigma, right? Or kind of continue stigma?
Yeah.
Yeah, I think sometimes, from my perspective, we utilize culture, and sometimes this can even be religion too, as like blanket statements, like what's
Yeah.
right and wrong, instead of understanding the logic behind the principle that exists, right? So if there's a rule, if there's a practice that is done, why do we do it is the most important part. And I think that's what ends up leading to a lot of stigma, is that we no longer think about the why behind a lot of these rules and principles and whatever, and practices, and we just do them because we've been told we're supposed to do them. But then over time as well, they get watered down and kind of misinterpreted, or kind of put into certain situations where it's no longer appropriate, or it actually is harming people. And so kind of understanding the why in the historical context. But that's what I see happens, is that we're, as a society, we don't ask why enough. We don't think critically enough about the decisions and the cultures and the practices that we participate in, to then actually be more informed in how we treat other people. And we do a lot of othering, and culture helps us do that. And that's part of our, evolution. Like that's what we're going to resolve. Like that's the default for humanity, right? Is because we want to other people to protect ourselves so that we continue to live. But we don't have to do that so much anymore in this society. And so kind of, I don't know, thinking of it from that perspective, but that's what I see is happening, and why we continue to see stigma. It's just so we can other people, so that we can protect ourselves, but we're forgetting that by doing this, we're actually harming people and potentially slowing down the growth of our society as well.
For sure. Yeah, hit the nail on the head with that, I think. Sam mentions that culture can reinforce stigma by making it normalized. I think we see that with a lot of youth, especially. If everyone is doing something, and we hear that a lot, and it's sort of the go-to or the cliche is, well, everyone's doing it, and the reality is not everyone's doing it. But if the people you're around are all doing something, then you think it's totally normal to do that same thing. So if everyone around you is, if you're 17 and everyone that you're friends with goes to parties where you drink, you just think that's normal, even though you're underage. And maybe even you come from a family that doesn't. If your friends and the people that you're spending time with do, then that becomes normalized. And that can go for anything. For sure.
I loved how Caitlin talked about asking why. That was pretty profound to me. In my own parenting, that's the way I try to approach my teenagers is this is why we hold these beliefs. This is why I don't want you to do drugs. This is why I don't want you to be sexually active at 15. And I feel like it opens doors to conversations that need to be had.
For sure. Yeah. Yeah. Asking why is very important. My next door neighbor growing up was a psychology professor, and he started every class that he taught. He walked in the room and he would ask, why do we do the things we do? So he asked that every single day, every single class. Why do we do the things we do? I think that's such an important way to evaluate ourselves, evaluate the culture we're a part of, asking why. Asking questions is never a bad thing. So for sure, that's a huge one. And then I told you I wanted to end kind of on a high note and close on a good question that would make us feel inspired, because I find a lot of times working in this field, it can be easy to feel weighed down and bogged down by things. But I think it's important that we continue to look at the bright side. So my last question is, how does culture fight against stigma? So in what ways is culture a positive thing when looking at stigma reduction?
Culture kind of adapts at times. And so I feel like the shift of focusing more on mental health and, focusing more on the substance use disorder and educating people helps to shift the whole dynamic within the culture.
Yeah.
Just like even hearing your statistics that you gave, it very much kind of resonated with me. It was like, yeah, we don't want that happening. We're going to turn a blind eye and pretend like that doesn't affect us. And those aren't areas that we need to deal with.
Yeah, for sure. And something that, even though the statistics, and we're talking about substance use stigma reduction, something that stood out to me with the statistics is that the statistics for mental illness are going down, right? So that perception is going down. So that's, I think, a step in a positive direction, right? That we're normalizing that people are people, and we've all got issues, all got things that we're going through.
But I feel like it also overlooks the fact that people often with mental health issues kind of have undiagnosed mental health issues, and instead they use substances and self-medicate.
Yeah. Oh, no, for sure. For sure. That is a big piece of it too.
And I'll just add, I think culture in itself, like just the the definition of it and its true core like essence is really beautiful. You know, it's about feeling a sense of belonging, and being a part of something bigger than yourself and sharing that and cultivating it. And so I think at its core, it's a beautiful thing. And when used appropriately, it could combat a lot of things, right? I mean, we don't necessarily, like if the culture is working in the best way possible, it's, in some ways, maybe you don't need laws or different, I don't know, right? Like this is like a kind of out there. But anyways, at its core, culture can help these things. And I think it also moves a little bit faster, maybe potentially, especially depending on the size of, you know, the group and different things. You can kind of rein in behaviors that are causing problems quicker than maybe some other response options that are out there.
Yeah, definitely. And that's sort of a perfect way to encapsulate today's discussion is culture in and of itself is supposed to be a good thing. You know, that's what society is. You know, functioning societies are based around culture and the cultures that exist within it. It's so important that you know, everyone has culture, and that's one of those things that, you know, you don't have a choice. You know, you're going to be involved in culture one way or another. It's just what kind of culture you're a part of. And so we've talked about this, and this is sort of the thing that I hope gets hammered home as we finish today, but especially as we finish the series, that the most important interactions we have are with each other. Those one-on-one or those group interactions, those are so important. And recognizing and understanding that people are people, that people, we're all going through life, we're all trying to figure things out, we're all going through different things, we're all struggling, but that there are options for if someone is using substances, if someone's addicted to substances, there are options, and that you know, the shame that's associated with addiction and with substance use isn't really all that helpful. That there are other ways to address the issue. So I'll stick around. You know, I've got 10 minutes here blocked off for the hour, so I can stick around if people have questions or if people want to continue to discuss. But otherwise, I'll let you get back to your day. And just a reminder, our next session is next Tuesday, and then we'll have our last session on next Thursday. So we're getting to the end here.